Hi guys, welcome to Chapter 8. In this video we are going to go through your skeletal system. We're going to take a look at quite a few different parts of the skeletal system. So let's go ahead and take a look at your PowerPoint. So I'm going to share my screen with you guys and open up Chapter 8. Yes, here we are. Chapter 8, the skeletal system. So let's take a look at this. So there we go. So our skeletal system. So in this chapter, we're going to take a look at the functions of the skeletal system, look what it does for us, and then take a look at how our bones are classified. They're classified according to the shape and the size. We're going to take a look at the difference between compact and spongy bones. So we're going to differentiate between those two based on what they look like and where those types of bones are found. We're going to take a look at the structure of specifically of a long bone. So long bone is one of our classifications, so I'll talk to you guys a little bit more about that. We'll take a look at, there's two different types of cells that are responsible for the growth of our bone. We have immature bone cells called osteoblasts and osteoclasts. Later they will mature and become fully mature bones in our bone tissue itself called osteocytes. But the immature bone cells that are responsible for its growth are those two right there, osteoblasts and osteoclast. So an introduction into our skeletal system, it's not just bones, but we are going to see bones, and we'll talk about that. But also joints. Joints are simply just where two or more bones are coming together. So we'll specifically look at joints. We'll also take a look at cartilage. There's a lot of places where we find cartilage. In fact, when we talk about bone growth, we'll talk about how when a child is born, is made up of a lot of cartilage and connective tissue, and eventually that cartilage is replaced by bone. But there's a lot of cartilage in our body that still remains. We are very familiar with the feel of our nose and our ears and how they feel kind of like a rubbery substance. That's because they are made up of cartilage and skin, whereas they're not made up of bone. But there's a lot of places where we find cartilage as its job is to protect, and we'll talk about that today. And then we'll see ligaments. If you guys have heard of the terms ligaments and tendons, the slight difference between those two, ligaments are simply where they're both connective tissues. Ligaments help to connect a bone to another bone, and a tendon helps connect a bone to a muscle. So that's why tendons aren't listed here. We'll actually talk about the term tendon when we get into our muscular system, but ligaments are definitely where we're going to see here because they connect bones together. We'll probably see some pictures of some tendons as well because we're going to see nearby muscle being connected to the bones. But that's what our skeletal system is composed of. What does our skeletal system do? One, our skeletal system supports our weight. If we didn't have our skeleton, we would just be a ball of muscles and organs and skin all over the place. But it helps to keep us upright. Working together with the muscle, which the contraction of our muscle tissue is also going to help to maintain our posture, but our skeletal system is definitely a part of that. Helps to support and protect our soft organs. They're the three most important organs in our body. Obviously, all of our organs are important, but the things that keep us alive are our brain, our lungs, and our heart. If any of those stopped working, we would have a really hard time, if not die. So those three organs are actually protected. Our skeleton is designed to protect those. Our cranial bones surround our brain, and then we have our rib cage that surrounds our lungs and our heart. And other organs are being protected by these ribs, but definitely those vital organs. With muscles, it enables our body movement. So we'll talk about how our skeletal muscle, when we talk about our muscular chapter, in our muscular chapter, we'll talk about skeletal muscle helps with the movement of our bones. Our bones also are very important for storing minerals. We get these minerals, calcium and phosphorus, we get those from our foods, from our diet, and blood is actually going to take those minerals to our bone tissue, which helps to, we're actually going to store those in case we ever need more calcium for any reason, but also it helps to keep our bones nice and strong. So for the storage of important minerals. And then it also contains bone marrow. Inside of our bone tissue, we have an important substance called red bone marrow, and that bone marrow is going to help to produce blood cells. So we've talked so heavily, we talked about this with skin, how skin cells have the ability to regenerate, and we're constantly creating new skin cells. Our bone cells are going to work very similarly, and then actually blood helps to do that. We're constantly creating new blood cells. Eventually blood cells will expire, And our bone actually is going to help to create that inside of our bone, I should say, our red bone marrow. So we'll talk about that when we get into that type of bone tissue. So there's many different sizes and shapes of bone, and our bones are actually classified according to those shapes. So the 4 words you see over there on the left-hand side of your screen are our classifications. And so these are a little bit easier because they're named, again, according to these shapes. So our long bones, exactly as that name implies, they are long, so they are longer in length rather than width. Whereas our short bones, just as that mentions there, that our short bones are shorter than they in shape, so they're typically a little bit more cuboidal. Our flat bones are flat in shape, and our irregular bones are just kind of odd shaped. They're very irregular looking. So the best examples are the ones that you guys can see here. We'll name these bones a little bit later towards the end of our PowerPoint today. But here, our long bones are typically our arms and our legs. This is particularly our femur, which is our bone of our thigh. So you can see that it is very long in shape. Whereas our short bones, these are the bones of our wrist, called our carpal bones. You can see that they're very, very small. There's quite a few of them here in this picture, but you can see that they are short in shape. And then we have our flat bone. So even though our frontal bone, which is the forehead bone there of our cranium, even though it doesn't look, it's kind of curved, it looks a little strange, it is actually, if we were to turn and look at it from the side, you would see that it's very, very flat in shape. Most of our bones that are designed for protection, like our cranium and also our rib cage, also our hip bones, the bones of our hip, all of these bones are kind of, you know, designed, I know they're all curved a certain way to go around our body, but again, if you looked at the width of it, you would see that they're very flat in shape. That's because they're flat to provide for the organs and everything else underneath. So a lot of those bones are our flat bones. And then our irregular bones, the very best example of our irregular bone would be our vertebral bone. You can see we've taken this right out of our vertebral column here. This is the bone that you see in the front. Our spinal cord is going to go right through here. And then we have all these kind of projections that come off the side of it. And I'll show you some examples from a better viewpoint of our vertebrae bone. And you can see that our bones, and you can see that they're very odd shaped. So that's as far as how that might be asked of you on next week's exam. If I asked about the classification, I would use the shape and I might use the example. So if I said the type of bone that is greater in length than it is in width, for instance, our arm bone, or I would specifically use the name of that bone, but we haven't learned that just yet. But in the term next week, I might use our humerus or our femur, like the picture we see there. And I'm looking for the term long. So just a heads up on that. Okay. Now, if I were to take that bone and any of these bones and take a look at the inside of the bone tissue, we're going to see 2 different types of tissues inside. These are just the classifications based on their shapes. But we have 2 different types of bone when we look on the inside. We have what's called compact bone, which is the hard bone on the outside. And then we have spongy bone, which is the soft, more sometimes referred to as cancellous, sometimes called, not Swiss cheese, but sometimes not called, but looks more open and more porous. It looks like a sponge. We find that on the inside, so a little bit deeper into the bone. So on the outside, we have this compact, the cells of our compact bone are really dense, really compact together, and that's what makes it that hard substance, and that's compact bone. Within that compact bone, we have these series called osteons, and I'm going to show you guys a picture of that. And then we have the spongy bone, like I said, is on the inside. It looks like Swiss cheese, but that is where our bone marrow is going to be contained. So looking at the picture we have here, so this is a great picture to show if we took a cut of our bone and we were looking at it from above and we're looking at this bone now, you can see our compact bone has all of these kind of these concentric rings. One of these series of rings is called an osteon, which is also sometimes referred to as a haversian system. Anything that has 2 names, guys, I will always on a test give you both of those. So no matter which one you studied, you'll be able to use either one, or you'll see either one if it's a multiple choice question. So, but one of these series of concentric rings, again, is called a haversian system or an osteon. And you can see that they've kind of opened this up here for us, and you can see in the middle of this osteon is a canal, is an opening that allows for the passageway of our blood vessels to move through. I mentioned earlier that bone is a storage reservoir for things like calcium and phosphorus, and in order for those things to get there, as well as oxygen, which is needed by every tissue, blood has to be able to pass through, has to be able to get there. And these osteons provide that opening for those blood vessels to pass through. So that's what we see within that compact bone. So on the outside here, this is the outside of bone tissue. It looks like we've just taken a little corner. What's outside is the periosteum. So that's the, there's a protective coating on the very outside of bone. So this surrounding there, and then right next to that is that compact bone. And then as we get deeper into the bone, as you can see, the bone becomes a little bit more open, a little bit more porous. And that's, again, you can see it looks like Swiss cheese. So that's our spongy bone. It is within those canals, those spaces of that spongy bone, where we find that red bone marrow. So we'll talk about that more so when we get into our blood chapter, but it's inside that we find that particular tissue. Our red bone marrow is where we're going to see blood cells being created. So that's the difference between our compact and our spongy bone. All right, now I want to take a look at one of those classifications of bone we're called long bones. Long bones have actually some different parts of them. This is very helpful when we're identifying just different sections of our long bone, but also helpful in clinical settings too, so that you can name, like if somebody came in with a fracture, we could identify where in that femur or humerus, which is our upper arm bone, where the fracture is. So this is just kind of showing us the different parts of a long bone here. So that's what we're looking at right now. We're looking at our upper arm bone, specifically called the humerus. We'll identify that a little bit later. But what we're looking at here, you can see that this bone, in most long bones, have kind of a skinnier middle portion, so the shaft portion, and then the two ends that look like they're a little bit wider, they're a little bit knobby looking. Those have specific names. This middle skinnier section is called the diaphysis, so the first term on that list over there. That's just that middle portion. And then those knobby ends are referred to as epiphyses, or epiphysis if we're looking at just one of them, but looking at the two of them together, these are called epiphyses. So we have one at the top and one at the bottom. The term epiphyseal disc, within that epiphysis, you guys can see this little line right here. We're going to talk about this more so when we get into bone growth. But that little line, the epiphyseal disc, is oftentimes referred to as the growth plate. In this picture, we're probably looking at the long bone of an adult, because that epiphyseal disc you can see is made up of bone. If it were to show up as kind of the way that they do in these animated type pictures, they typically show it as blue or a little bit lighter. You could see it on an x-ray, you can see it looks a little bit different. If it was mostly cartilage, then that would mean that we're looking at probably the x-ray of a child that still has some growth left. Over time, that cartilage will eventually be replaced by bone tissue, and that's how a child gets taller. So that growth plate, or also known as the epiphyseal disc, is right here within that epiphysis. We'll talk about that more so here in just a second when we talk about bone growth. In that diaphysis, if we were to open it up and look on the inside, the cavity where we find marrow, in this case we're talking about the humerus, so we're looking at, of this long bone, we're looking at yellow marrow. You guys don't need to worry about yellow marrow. It's got some adipose tissue in it, but red bone marrow is typically found in other types of bone. But in that middle cavity, that's referred to as the medullary cavity. We had pointed out the periosteum on the previous picture, but the periosteum is just a thin membrane that surrounds the outside of this bone tissue, specifically of the diaphysis. But that periosteum, for those medical terminology people that are looking at breaking down this word, typically peri we'll see as a prefix given to outer structures, like our outer membranes. Like when we talk about the heart, we'll talk about how the outer membrane of the heart is called the pericardium. So that prefix peri is given to the outer membrane. Here, since we're talking about bone, we're talking about the periosteum. And then on the ends, I had mentioned earlier that cartilage that was left in our body is particularly left there and is responsible for protection. So particularly here at an articulation, which is just another word for the word joint. Remember, I'd mentioned joints earlier. A joint is simply where two or more bones are coming together where they meet. So here at the top of this is the humerus. So this is actually where this bone is going to meet with our shoulder. So that's going to be where it forms that joint, or again, another name for that is an articulation. That's going to be where that meets, where that articulates. And so the cartilage at that area is called articular cartilage. The reason why we have that cartilage, because when I'm moving my arm around at my shoulder, I don't want my shoulder to be rubbing up with my humerus here, with my upper arm bone. I don't want the rubbing of bones together could cause damage and can be very painful. So instead, we have this cartilage that's going to serve as kind of like a rubbery type substance that's going to help to serve as a protection for that bone. And you can see we have some articular cartilage down at the end as well for where it meets with my lower arm. So there's the elbow. So we'll see a couple more examples of that cartilage, but that articular cartilage is there for that reason, for protection. And as I mentioned, we were talking about the epiphyseal plate or the epiphyseal disc or the growth plate. We have what's called ossification. Ossification is just another name for bone growth. We have two different types of this ossification, and it takes place in two different places, and it's replacing two different types of tissue. So we have what's called intramembranous ossification. This takes place specifically in the flat bones of the skull of a child. This is the replacement of thin connective tissue membrane within the skull. So that membrane, so think it's the replacement of the connective tissue membrane. So there's where the term intramembranous comes from. And I'll show you a picture to help you remember on the next slide to show you that that intramembranous ossification only takes place in one area of the body. Whereas endochondral ossification takes place everywhere else, in long bones, irregular bones, short bones. This is the replacement of that fetal cartilage skeleton within the bone. So this is, I hope you guys don't see that little pop up. This is the finishing of another video that I just created. There it goes. So in this case, so I talked to you guys about that epiphyseal disc. That was where I was talking about that if there was cartilage, that cartilage would eventually be replaced by bone tissue. And that's what I mean by that. That's the responsibility of that child getting taller and getting bigger. So on the next slide, showing you the same thing. Intramembranous ossification takes place in the flat bones of the skull, replacing that connective tissue membrane. Whereas endochondral ossification takes place everywhere. This is, again, the replacement of cartilage tissue. And eventually that's all going to be replaced by bone tissue, and that's what's happening in the growth and development of a child as they continue to get taller. Those bones will become taller and wider. So speaking of that process, our bones growing taller, this occurs within that epiphyseal disc. What we have, again, I had mentioned to you guys real briefly, we have two different types of immature bone cells within our bone called osteoclasts and osteoblasts. Osteoclasts, although not mentioned on this picture here, or I mean on this PowerPoint slide here, osteoclasts are the ones that break down old bone tissue or old cartilage tissue. Osteoblasts are the ones that come by and build up the new tissue. There's a better picture on the next slide that I'll show you guys what I mean by that. And I've also added a video for you guys in that review section where I actually posted these PowerPoints, and I also provide for you guys some review diagrams. There is a video, it's a YouTube video that I always like to use because it gives a visual of the difference between osteoclasts and osteoblasts. If osteoblasts, as they're coming through and they're building, they eventually will mature, and they then embed themselves in the bone tissue itself. They mature and they become osteocytes. Those are our mature bone cells. Our bone growth is affected by hormones. Typically, we have what's called the growth hormone, which is more active in the growth stages of childhood development. We'll talk about hormones a little bit later. But then during puberty, especially when females are developing more estrogen and males are developing more testosterone, that's definitely going to take a huge impact on our bones and the growing of our bones. Here's that next picture I was telling you about. That bones also grow wider. So osteoclasts are the sculptors. They're the ones that hollow out that bone tissue, whereas our osteoblasts, those are the builders. I oftentimes remember the difference between these two words because I remember the B for blasts represents B for builders, if that helps. So osteoblasts are the ones that deposit bone on outer surfaces. Osteoclastic activity is referred to as resorption. So think of it as starting new, you know, that we're tearing down that old bone tissue and replacing it with something new. So that's what that represents, that resorption. So this takes place in that endochondral ossification, but also, you know, in the instance where somebody breaks a bone too. If I were to break a bone in my lower arm, what would happen when that bone breaks? I oftentimes will get put in a cast. That cast is simply to make sure that that bone is straight when it goes through the process of ossification, because when ossification takes place, my bone tissue will slowly start to replace itself and we'll start to put it back together again. And the doctor putting me in a cast is going to make sure that it does so in a straight fashion. So that bone growth is really important for both, you know, a child getting taller, but also in the event of healing. Our bones have all kinds of different bumps and grooves, and on the next, I'm going to click forward to a couple different slides to show you guys that in your PowerPoint, I have provided you guys with a couple pictures I found on the internet. These are not from your book. These are from Google. I was simply trying to find a picture. The PowerPoint didn't have a picture. That these pictures are all showing you guys these different grooves and processes and just different markings of our bones. As we have not just straight bones, sometimes they have little projections on them and such. So speaking of, we have, for instance, condyles and epicondyles. A condyle is a large knob in a bone. So going to these pictures, I'll click back and forth to show you guys, like here, looking at the middle picture, looking at our femur. So the two knobs here are referred to as condyles. But if you go down to the picture of the femur in the lower left, there's those condyles still. But then the little bumps next to it, an epicondyle is simply just a smaller version of a condyle next to a condyle. I know that's kind of confusing, but that's what that means. Excuse me. Condyle is a large knob, and an epicondyle is kind of just an enlargement nearby. The head of a bone is an enlarged rounded end. So just as we think of the head of our body, it's the enlarged rounded end of our body, very similar on a bone too, and I'll show you a picture of these. A facet is a small flattened surface. We'll see some pictures of that. And a crest is a ridge. So let's move forward. Let me show you guys a couple pictures. So here you can see in this picture on the far left-hand side, there is a facet. We're looking at a thoracic vertebrae. Again, remember this is an irregular bone because of such the odd shape. There's the opening where the spinal cord is going to go through. But a facet, this flat portion right here, you can see. Let's see, there's a crest. So looking at the edge of this is called a coxal bone. This is the hip bone itself, but that ridge right there is referred to as the crest. Looking at this irregular vertebrae bone again, that spiky part right here, that will lead into the backbones. That part is oftentimes referred to as a spine. So in fact, that's what you guys can see here. The sharp projection is referred to as the spine. A tuberosity is just a knob-like projection, but if we're specifically talking about the femur, a tuberosity is specifically called a trochanter on the femur. I know that's confusing, but let me show you what I mean. So I'm going to go to the second picture here. Here you can see the trochanters. They're kind of these, so here's the head of the femur where it's going to meet with the hip, but then these two knobs are typically referred to as tuberosities on any other bone. But because we're talking about the femur, these are called trochanters. So there's the third picture that I've posted is just specifically of the femur, and you can see those condyles and the epicondyles. But here, what's typically referred to as a tuberosity, which are just knob-like parts of a bone. So there's the head. These are called trochanters on a femur. So specifically, the smaller one's called the lesser trochanter, and the bigger one's called the greater trochanter. And just a few more terms here. A foramen is an opening. We're going to see a couple different pictures of an opening. Typically, an opening will be a passageway for things like blood vessels, nerves, ligaments, what have you. Particularly today, we're going to talk about at the the skull bone called our occipital bone in the very back of our skull. It has a big hole in the middle of it, and that is because we need a passageway for the spinal cord to pass through. And so that's going to be called specifically the foramen, called the foramen magnum in that particular case, but that's what that's referred to as. A fossa is a groove. A meatus is a tunnel-like or tube-like passageway. Today, when we look at the bones of the skull again, we're going to talk about the temporal bone as the bone that's located at my ear. But the ear, I need the hole to go through for, sound vibrations to pass through into my ear. And so that opening is called the external auditory meatus, and that tube-like passageway. And then we'll also specifically look at our sinuses today. Sinuses are just cavities or hollow spaces within our bone. So we're going to see a couple more examples of those. So there's a couple pictures for you guys to look at to kind of get familiar with those particular terms so you guys can have a visual. I don't know if you guys are like me, but anatomy to me is very visual. So when it just gave me the definitions and didn't provide an example, that's when I turned to Google. Google's a great resource for information. I went to go find some pictures for you guys so you all can see exactly what those definitions mean. So there's a couple different examples for you. And then finishing this section, when we talk about breaks with our long bones, broken bones can be classified in 3 different ways. Just because we're talking about just bones in general, it does mention the breaks here. So breaks can either be called simple, compound, or green stick. A simple broken bone, a simple break, or sometimes even a simple fracture means that the bone has broken within the body. So within, it has stayed in the skin. A compound break oftentimes is a little bit more severe because of the fact that the bone will actually protrude out of the skin. So a compound break or compound fracture, if the bone comes out of the skin, it's called compound. And again, it is a little bit more severe because now it's open to the outside where it's exposed to the elements and exposed to things like bacteria. And so this is something that instead of straightening the bone back out, never do that, never try to put it back in. Instead, we get to a hospital where we get into a more sterile environment, and that can be done so properly. And then a green stick, as they show a picture of a stick over here, that if it's just a fracture, so it just hasn't gone all the way through, that's what a green stick break is that it's just an incomplete break. So those are your 3 different types of breaks. Now we get into the next section, and the last section, I should say, of Chapter 8. We're going to look at the difference between and label all the different bones within the axial skeleton, the appendicular skeleton, and then all of our joints. I'm going to classify, there's 3 different types of joints. So we're going to list the bones of the axial skeleton. Axial is simply just in the middle of our body. We're going to label important landmarks and selected bones within the axial skeleton. Then we're going to take a look at the bones of the appendicular skeleton, which includes all of our arms and our legs, and label important landmarks and bones with those. And then we'll get into the types and functions of joints and type of joint movements is what we'll finish up with. All right, so let's get into the axial skeleton. The axial skeleton is like I said, the skeleton in the middle of our body, so that includes our head, that includes our cranial bones and our facial bones, and we'll talk about those separately. Our hyoid bone, which is the bone just on top of our, within top of our throat above our larynx, that is actually a bone that controls the tongue movement. We won't label that today, but that's what that is. Our vertebral column, there's a lot of bones that go down our back. We're just going to talk about different sections of our vertebral column today. And then our thoracic cage, which includes our ribs, our sternum, which is the breastplate, and our thoracic vertebrae, which those ribs connect to. So let's start with the bones of our skull. The cranium is composed of 8 different bones. We have a frontal bone, we have 2 parietal bones, 2 temporal bones, an occipital bone, a sphenoid, and an ethmoid bone. And you guys are looking at that going, what did she just say? I'm going to show you guys a picture of these. There's a picture in your book, and then there's also a picture that I've provided for you guys in the review section, so where you guys typically find your PowerPoints for each chapter. As you guys know, I categorize each week with week 1 lectures, week 1 discussion, week 1 homework, and then there's the PowerPoints and review. And in that category, in that folder, you guys will find some review sheets, and there you'll find labeling diagrams for both the bones of the skull, we've got the bones of the face, and then we've got a skeleton picture. And I'm going to walk you guys through all of those diagrams in this video. Then we're going to talk about our facial bones. We'll talk about how the mandible, which is our lower jaw, is the only movable joint. So the joint where that connects up here is the only movable joint in our entire skull. Our hyoid bone, again, like I said, controls the movement of the tongue. It's also at the very top of our throat. It's a little bit deeper. I keep going like this, but the hyoid bone, for those of you guys who watch any type of investigative shows, typically the hyoid bone is, if there's any damage or break in a hyoid bone, typically indicates some type of strangulation. So just, I know that's kind of a morbid way of thinking of it, but it's also a way to remember it. So that's a hyoid bone. And then our middle ear bones, there are 3 bones within our middle ear. So technically they're in our head, but we're actually going to label those when we get into describing our ear. So when we talk about our senses chapter, we'll get into that in a few weeks, or I think actually next week. I always get the weeks confused. We'll talk about that later. Okay, so these are the pictures that you guys will see in your book. This first picture on the left is showing the cranial bones. We're going to label 6 of those. And then this picture on the right is the facial bones. And I've got 2 different sheets that I'm going to walk you guys through that look just like this, but they're actually blank, so you guys can fill them out. And I'm going to walk you guys through it. So if you guys already have those printed and you're walking through that, if you're studying, definitely a great idea to do that, so that you guys can walk through them with me, and so I can help you guys with those. So in this, so if you guys are doing that right now, your frontal bone, this picture is this colored as green. Obviously our bones are not colorful. The reason why your book does this is because the suture, which is a type of joint we'll talk about later, they're so small in the cranium that it's hard to differentiate between 2 different bones. So the use of different colors helps to show where the frontal bone ends and the parietal bone begins. It's also a great study tool. Your brain draws amazing associations when we're studying, and sometimes coloring helps us to do that. You know, if you use a coloring technique, if you maybe color the frontal bone green like they've done here, and maybe right frontal in green as well, your brain can draw that association. And then maybe when you're looking at it later and you're looking at a black and white image, it might be easier for you to go, oh, man, what was that? It was colored green. Oh yeah, frontal. It's just amazing how the brain draws associations. And we also draw the association when we're coloring. Our brain thinks that we're doing something fun, but what you're actually doing is you're taking in these terms as you're doing so. In fact, I found at Half Price Books in Louisville, for those of you guys who are my Florida students or Ohio students, you guys might have something similar, but it's just a cheap used bookstore, and I found an anatomy coloring book. I would provide you guys pictures from this, but these are super detailed, and these are for like somebody in med school, but it's a great way to study. So I definitely recommend, you know, maybe printing out the pictures in the review folder that I've sent you and maybe using those as coloring pages. And again, you are doing something fun, but your brain is associating those terms and associates it with that fun. So I recommend that. But as we go through these, so if you are on that diagram, number 1 is pointing to the bone right there in the front called the frontal bone. So in both of these pictures, you can see the frontal bone pretty clear. We see that as a forehead bone, but it's right in front, so it's called the frontal bone. On either side of our skull, so colored there at the top in blue, those are called the parietal bones. So that's number 2 on your diagram. Number 3 on your diagram is this teal colored bone that has that opening to our ear, right at where the ear is. That's called the temporal bone. Number 4, we only have one of these at the very base of our skull, at the very back, is called the occipital bone. In front of the temporal, number 5 in your diagram is called the sphenoid bone, this purple bone right here in the front. And then number 6, and this dark purple color, not to be confused with the light purple in the front. Oftentimes people confuse the ethmoid and the lacrimal, but the ethmoid is what number, oops, let me go back, there it goes. The ethmoid is what number 6 is pointing to. It actually goes deeper into the skull, so it's definitely part of the skull and not part of the face. Whereas we get into the facial bones in just a little bit, the lacrimal bone is what's being pointed out in the inner eye socket. It doesn't go deeper into the skull, it's simply just that bone in the inner eye socket. So be careful not to confuse the ethmoid with the lacrimal. So if you're labeling the bones of the cranium right now, number 6 is the ethmoid. Okay. So I'm going to come back to this picture when we look at the face, but this PowerPoint does walk through a little bit more with that. And there's the diagram for you guys. So number 1 is the frontal. Number 2 is the parietal. Number 3, there's our temporal. So it's a little bit bigger, so it's easier to maybe see this. Number 4 is the occipital. Number 5, there in blue, is the sphenoid. And number 6, there is the ethmoid. In this picture, it's not labeled for us, but that bone-colored part that's right in front of that, that's the lacrimal, which we'll talk about with the facial bones. Okay. As you guys go through this cranium here, that it does define these a little bit further, but as long as you guys kind of know how to point these out and know where they are, you don't have to worry about these different processes. I do want you guys to know in the temporal bone, so we just saw this, the temporal bone there in number 3, there's our opening for our ear canal. We know that as the external auditory meatus. So we talked about how meatus is a tube-like opening. So I do want you guys to know that auditory meatus, our ear canal. But don't worry about the zygomatic process, the styloid process, or the mastoid process. Those are pointed out for us down here. And the TMJ joint is just where the mandible is the only movable joint there. But you guys don't need to worry about that. Just know the bones. In the occipital bone, if you guys can see in this picture over here on the right, again, that was that green colored bone from that diagram. That was the bone we labeled as number 4. If we look at it from underneath, you will see that there's a big hole in the middle of it. That hole, called the foramen magnum, if you guys remember from a couple slides ago, we talked about how foramen means opening. That foramen magnum is the opening for the spinal cord. So I do want you guys to be familiar with that. It does point out the occipital condyles, but you guys don't have to worry about those. I do want you guys to know what a condyle is, but you don't have to worry about specifically pointing out the occipital condyles. Definitely, though, be familiar with the foramen magnum. Okay. The sphenoid bone, it is butterfly shaped. It forms the floor and the sides of the cranium. Not that you guys have to know that. Just know the sphenoid bone was number 5 on your diagram. So don't worry about sella tertia either. And the ethmoid bone was the last of our cranial bones, number 6, between the eye orbits. It is a supporting structure of the nasal cavity, so that tells you it does go a little bit deeper, and the nasal cavity is just beneath it. Okay, now we get into the facial bone. So I'm going to go back to that picture. There is, and I'm going to walk you guys through the specific picture that's very similar to the diagram that I've provided for you guys, but I'll tell you what number everything is here. So I'm looking at the picture on the right now. This is the one from your all's book that shows, you know, the picture of the face from the frontal view here. So if you're looking at my diagram that I gave to you guys, number 1 is pointing to the bones right on top of our nose. Those are our nasal bones. And in the skeleton, you guys can see that there is no nose on the bone, on the face here, and that is because our nose itself is made up of mostly skin and cartilage, so it wouldn't be on the skeleton. The only bones in our nose are those ones at the top. So number 1 are the nasal bones. Number 2 is pointing to those lacrimal bones. So in the bones of the face, number 2, the lacrimal are the ones inside the eye sockets. I often associate that with our tear ducts. Our tear ducts are also known as our lacrimal ducts, and we'll talk about that later when we talk about the eye. But that's how I'm drawing that association to remember the lacrimal bone is in the same area. Number 3 on your all's diagram is pointing to this upper, right above the teeth, so our upper face goes on either side of the nose before it reaches the cheeks. That's our maxilla. Sometimes people call it the maxillary bone, but maxilla is just fine there. And then number 4 is pointing to the only bone that moves in our face and our cranium, is called the mandible. Number 5 is pointing to what we commonly know as our cheekbones, but these are called the zygomatic bones on either side, that kind of peach color on your diagram there. And then lastly, number 6 on your facial diagram is pointing to this thin little bone on the inside of our nose that's called the vomer. All right, so let's go to the diagram that you guys are looking at. So there's our facial bones we've listed there. We don't worry about the palatine bones. The palatine is referring to the inside of our mouth, and you guys don't need to worry about that just yet. This is all I want you guys to be familiar with the face. Number 1, again, we pointed out the nasal bones. Number 2, lacrimal. Number 3 are the maxilla, or is the maxilla. Number 4 is the mandible. Number 5, those are the zygomatic bones. And number 6, that thin little bone right there, is called the vomer. Okay, those are our facial bones. I did mention that we would talk about our sinuses. You don't have to know the specific names of our different types of sinuses, but helpful to know the bones because you already know the sinuses then because they're named accordingly. So these are simply what a sinus is, though I want you guys to know that. These are air-filled cavities that serve a couple important purposes in our cranium. They are there to help to lighten the weight of the skull, and they also help to modulate the sound of our voice. When we get into our respiratory system, we're also going to talk about how our sinuses help to warm and moisten that air that passes through the nasal cavity. So you can see in this picture here that they are simply just cavities of air. And we have a couple. There's the frontal sinus there in our frontal bone. We have the ethmoidal there within the ethmoid bone, our sphenoidal, and then our maxillary sinuses. We typically don't notice our sinuses until they are filled with mucus when we have a sinus infection, but they are there serving an important purpose even when we don't have an infection. So how are our skull bones held together? I pointed out in one of those pictures earlier, I was showing you guys the coronal suture. A suture, and you don't have to know the specific names of them, but a suture is a type of joint. It's where two bones are going to come together, but a suture specifically, there's no need for any movement at those two bones, but they're the small little cracks that we see in our cranium, and it's where those bones come together. It's how they're held together. So that's a suture. So I'd be familiar with the term suture. In an infant, I told you guys earlier that an infant skull contains a lot of soft spots, a lot of cartilage, a lot of connective tissue membranes that will eventually be replaced by bone. And that's where the term fontanelles come in. Fontanelles are soft spots in a child's skull. There's the anterior and occipital fontanelles. They are just simply soft spots where bone has not been, put in that skull yet, hasn't been replaced yet. That, again, the connective tissue and then the cartilage. It is covered with a fibrous tissue, and this is going to allow for that cranial growth. So here you can see at the top of the baby's skull and at the side of the baby's skull, you can see these larger portions of, like I said, cartilage and connective tissue. There's those soft spots, those fontanelles. So I do want you guys to know what a fontanelle is. So very sensitive tissue. We want to be careful with an infant's skull because it is not hard like that compact bone just yet. Since it hasn't been replaced with that tough tissue, they're a little bit softer and more sensitive. Okay. Still with our axial skeleton, so we already covered the bones of the skull and the face. Now we're going to get into our backbones, and we simply just want to name the different curvatures of our backbones. Our back has a natural curve, as you can see in this picture here. And I don't want you guys to worry about the specific numbers of these, but I'm going to point some of those out. I just want you guys to be familiar with these different names. So for instance, here at the neck, so this is our entire backbone from the top. This is where it's going to meet our head, and then down here at the bottom where our pelvic bones are going to be located. So at the top here, this is the bones of our neck. These are referred to as cervical. So we may have if you remember, we talked about how the cervical region of our body is our neck region. We'll see cervical come up pretty often, but our cervical backbones are those are the ones at the neck. So the cervical vertebrae. Then if you guys recall from talking about our body cavities last week, we talked about how the chest cavity was called the thoracic cavity. Well, just behind that, our upper back is referred to as our thoracic vertebrae. Like I said, you notice that those are numbered. You don't have to know how many are in each particular section, but if you ever hear somebody referring to, say, T5 or T7, then you know that they're specifically talking about the T for thoracic and that they're talking about the fifth particular, or seventh in that example, the vertebrae in that section. And just as kind of a fun fact, when we get into the ribs here in just a couple slides, we'll talk about how there are 12 pairs of ribs, and all of those attach at the backbone. So the 12 pairs of ribs, that's why there's 12 vertebrae in the thoracic section. Then we have our lower back. Lower back is referred to as lumbar. I oftentimes thought lumbar, so L for lumbar, L for lower back. Or sometimes people say they need more lumbar support. That's just referring to the lower back, the lumbar region there. And then down here at the base, we have two different bones in this, what's called the sacral curve down here. This sacrum is the bone that's just between our hip bones, kind of a V-shaped bone. It's actually a couple different bones that have been fused together, but it's called the sacrum. And then just beneath that, this teeny tiny little bone down here at the bottom is called our coccyx. We oftentimes refer to the coccyx as our tailbone. So I do want you guys to be familiar with how that will be asked on a test next week. If I said the name of the backbones or the name of the vertebral bones at your upper back is called the what? I'm looking for thoracic. Or if I said the name of the vertebrae located in the neck region, those are called cervical. So that's what I'm looking for there. If I said another name for your tailbone, I'm looking for the coccyx. So that's what I'm talking about there. So do be familiar with those particular terms. So our vertebral column is responsible for our structure and support of our head and our thorax. It is the attachment point for the pelvic girdle, so that's just where our lower limb, so our leg, is going to meet with our hip. So they're, you know, our bodies, our vertebrae are responsible for that. It encases and protects the spinal cord, so the spinal cord does travel through the center of the vertebral column, so that's going to protect it. And it is going to provide for that flexibility, the movement in my back. And all of those different sections are named according to their location. So with this, on this PowerPoint, I want you guys to be familiar with, I said you guys didn't have to worry too much about specific names, so worrying about how there's a T3 and T4 and all of that. But I do want you guys to know the very first two vertebrae, C1 and C2. So remember of our cervical section, so that's at the neck. The very first one is called atlas. It's called the atlas. This is the bone in our neck that's responsible for the nodding motion that we can make. Whereas the second one looks a little bit different, and it's responsible for the rotation. So comparing yes and no. Yes is when we're nodding, no when we can rotate. That's called the axis. You don't have to worry about other vertebral parts, although I'm going to show you guys a picture that points those out. But I do want you guys to know that in between each of these vertebrae are called intravertebral discs. They're pieces of cartilage that are there, again, as I mentioned what cartilage was earlier. Cartilage acts as a cushion and is going to help to protect our vertebrae bones as we're walking, and it keeps them from bouncing up against one another. All right, so there's the anatomy of the vertebrae. So there you can see our atlas is responsible for the nodding motion. There's the axis that's responsible for the rotation. And there in that picture of the vertebrae, you can see what's colored as little pieces of blue. Those are those intravertebral discs I was referring to. All right, so the body is padded by these cartilaginous discs, supports the weight of the vertebrae. Some processes provide sites of attachment for things like ligaments, tendons, and muscles. Some are going to articulate with other bones. So like I mentioned with the thoracic vertebrae, all of our ribs are actually going to attach at those backbones of our upper back. So we'll see that. And again, articulation just means forms a joint with, so connects with. And the vertebral foramen, so that foramen meaning opening, is the opening for the spinal cord. And again, they are padded and separated by those cartilaginous discs. So whenever we see disorders of this curvature, we have that natural curvature, but sometimes we see a little bit more in extreme ways. So for instance, scoliosis is a is a lateral curve. Remember, lateral means side to side. Medial, right, would be going down the middle, but when we have that where the backbone goes a little bit to the side, I don't know if you guys were like me, but when we were in school, we used to have to do scoliosis checks where we'd have to bend over and somebody would check to make sure that our backbones were aligned straight. Kyphosis is hunchback, so that's when your thoracic vertebrae are a little bit too curved and go a little bit, too far to the back. And lordosis is sway back, meaning those lumbar vertebrae are protruding a little bit too far to the front. So we're seeing disorders of that natural curvature of our vertebrae. That's what we're seeing. Those are a couple examples. Okay. So with our rib cage, our thoracic cage includes our sternum, our ribs, and our thoracic vertebrae, and I do want you guys to be familiar with these. So our sternum is our breastplate. The top of that is called the manubrium, and the bottom of that is called the xiphoid process, the middle of it just being the body. And I'll show you guys a picture of this on the next slide. Our ribs, we have 12 pairs of ribs. We have what's called true, false, and floating ribs. The first 7 pair are called true, and the last are called false. So let me show you guys this next picture. So here's our rib cage. In the middle, there's our sternum. So we commonly know that as the breastplate. So the middle of it's the body. At the top, sometimes, people refer to this as like the head of the sternum. So the top of it is called the manubrium. And the bottom of it there is called the xiphoid process. So that xiphoid process, to know that, it used to be, it might be a little bit different now, but the way CPR was taught, sometimes you were taught to use 2 fingers to find the xiphoid process, and then under that is where you could start your chest compressions. I haven't taken CPR in a little while, so I just remember that being taught to me that way, and that's how I always remember the xiphoid process. But then now looking at your rib cage. So your rib cage is this entire cage right here. But we have, again, I mentioned that the first 7 pair are called true ribs. And that is because these first 7 pair actually connect directly to the sternum. So because they connect directly to the sternum, I always thought about that as they truly connect to the sternum. Whereas the last couple pair do not. If you can see, numbers 8, 9, and 10 actually connect to rib pair number 7. So they are falsely connected to the sternum. And then the last 2 are also considered false, but the last 2 by themselves are considered what's called floating because they connect to the thoracic vertebrae, but they do not come around to the front at all. So they're not even trying to connect to the sternum. So they would be classified as false, but looking at those 2 on their own, they're called floating. So that previous picture we were looking at, it says again, the 7 pairs of true ribs, we have 5 pairs of false ribs, including those 2 pairs of floating. And then our thoracic vertebrae are included in that thoracic cage. Okay, so then we have the bones of our appendicular skeleton. Appendicular skeleton just simply means our arms and our legs, so our appendages is a way to think about that, appendicular appendages. So we're first going to talk about our upper arm and our upper limb, and then we'll talk about our lower limb. And then we'll talk about their attachment points too. So we have the shoulder girdle, so where the upper limb meets the body. And then we have the pelvic girdle, where the lower limb meets the body. We're going to talk about all of this. So let's first look at the upper limb. So first talking about the pectoral girdle, which we commonly know as the shoulder girdle. At that point, we have what's called the clavicle in the front. We commonly know that as our collarbone. Fun fact, it is the most commonly broken bone in the human body, I guess because how it can be easily broken when you land on your shoulder. I actually broke mine when I was in the 5th grade. Not fun. And then we have our shoulder blade known as the scapula, or scapulae if we're looking at the 2 of them together. Plural for scapula is scapulae, if you ever see that E added on the end of it. And then we have our upper limb. And so I'm going to show you guys a picture of all of this, but we have our humerus as our upper arm bone. Our radius and our ulna are the lower 2 that are in our lower arm. And then our wrists are our carpals, our hands are our metacarpals, and our fingers are our phalanges. I went through that really quickly so I can go through it on the picture. So looking at our picture here, so over here on the left side, here you can see the scapula is the shoulder blade that's actually located more towards the posterior side of our body in the back. And then our clavicle is the one in the front there. For those of you guys who have already printed out this diagram, I'm getting ready to walk you guys through that, but number 1 is the clavicle, number 2 is the scapula. Number 3 is actually the sternum, so we'll get to that. The upper arm bone, so we have one upper arm bone, and it's called the humerus. I know this is a weird way of remembering this. It's not spelled the same way as humerus, like funny humerus, but the end of the humerus we commonly refer to as the funny bone. So I oftentimes think that the end of the humerus is the funny bone, even though it's not very humorous at all. I know it's silly, but that's the humerus. And then there's our elbow joint. Excuse me, our elbow joint there. And then our lower arm, we actually have 2 bones in our lower arm. We have what's called the ulna and the radius. And no matter what, you can see that this person is in anatomical position where the palm is facing forward. So you can see on the side of the thumb is the radius, and on the side of the pinky is the ulna. And you should know that that never changes. The one on the side of the pinky is always the ulna, and the one on the side of the radius, side of the thumb is always the radius. No matter how we turn our arm around, if you look at the picture over here on the right, it shows, we'll talk about the term supination later, which simply means palm facing upward. You can see that the radius is there on the side of the thumb, and the ulna is on the side of the pinky. But then when this person turns their hand over, notice that the radius turns over top of the ulna, and the radius is still on the same side of the thumb, and the ulna is still on the same side of the pinky. So that's a way to remember that no matter how our hand is turned, the ulna, or the smaller word of those two, is always on the same side of our small finger. And then the radius is always on the side of the thumb. And then you get down to the hand, and they have these 3 sections here. Our wrist bones are referred to as our carpals. If you or anybody you know has ever been affected by carpal tunnel, that's where that term comes from. Somebody who maybe uses their hands a lot, like types or writes a lot, oftentimes they are affected by carpal tunnel, and that is a disorder of the carpals. And then as we move down from our carpals and our wrists, we move down to our hands. Those are, then we just add the prefix meta. So it's the metacarpals, and then we get to our fingers, and those are the phalanges. All right, so that is the upper limb. And I'll show you guys that on the diagram too. So don't worry, I'm not going through this very, very quickly. Just to rush you guys through it, I'm going to walk you guys through it on the diagram that I gave you guys too. Then we get down to the lower limb. We have the how the leg is going to attach to the body is located at the pelvic girdle. The pelvic girdle is actually a combination of 2 bones called our coxal bones. So we've got one on the left and one on the right. And you can see right there in the middle is the sacrum, which again is the end of that vertebral column. But the pelvic girdle is designed for weight bearing. It is also attached to our lower limb. So that should say lower limb. It looks like I took this picture and put it on top of the words there. I'm sorry. But it is the attachment point for our lower limb, and it also helps to protect those organs within that pelvic cavity. Like I said, it is the combination of 2 bones that are fused together. There are 2 coxal bones. We have one on either side, and the coxal bone is made up of 3 different sections. We have at the top, so what's colored in pink in this picture is called the ilium. And so when we think about our hip bones, that's the ilium. The flared portion of the pelvic girdle itself is called the ilium. So one on either side. The rounded portion of our pelvic girdle down here, down at the bottom, is called the ischium. Kind of a strange way to put it, but this is your butt bone. This is when you sit down on something really hard and you hit really hard and you feel like you've hit a bone, you've hit your ischium. That's what that is. And then the area towards the front, we oftentimes refer to as the pubis or pubic area there in the front. That's the pubis of the coxal bone. So there's one on either side. And then where the 2 pubis bones come together is the pubic symphysis there, that little piece of cartilage in the middle. We'll see a better viewpoint of that here in just a second. Okay. And then just to show you guys, there is a slight difference in the pelvic girdle between a man and a woman. A female pelvis, you can see, is a little bit wider. The ilium is a little bit wider. And then the opening is a little bit more open. That pelvic outlet, you can see, is a little bit wider as well. And that is simply because of the female responsibility of being able to birth a child. Okay, so now we go down to the attachment point. We have the lower limbs. So our upper leg bone is called the femur. We talked about the femur pretty heavily earlier with the trochanters we were identifying. The femur is the largest bone in the human body, just as a fun fact. And then the kneecap is referred to as the patella. So that little bitty bone right there in front of our knee is called the patella. And then just like our upper limb, in our arm we had one upper bone and we had two lower bones, very similar in the leg too. We have two lower bones. We have the tibia and the fibula. So the tibia we commonly refer to as our shin. It's the bone that's in the middle, and it's a little bit larger than the other bone, but it is very centrally located, and that's the tibia. And then on the outside, that's on the lateral portion of the leg, a little bit thinner of a bone, that's the fibula. I had a student in class one time who told me that she always remembered that a little white lie was called a fib. So the smaller version of a lie, I guess, so that was a fib. So the smaller bone in the leg, she remembered, started with the letter fib, or the prefix fib. And then I also want to point out that pay attention to those terms, that is tibia versus fibula. I have a lot of people who oftentimes want to call that tibia and fibia, but notice it's not fibia, it's fibula. So remember that's really important when it comes to spelling and pronunciation of those words. It's tibia and fibula. And then we get down to the foot bones. The foot bones we have very similar to how the wrist and hands were called carpals, metacarpals. In the feet, those are just called tarsals and then metatarsals. So tarsals are your ankle bones, and then your feet bones are called the metatarsals. And notice that the bones of our toes are named the same as our fingers. Those are called the phalanges. The arches of the bone are what forms that instep, so those serve a very important purpose. Well, that natural arch is supposed to be there in our feet. So there's a picture of our foot. So there you can see the tarsals, there's the metatarsals, and then there our toes are our phalanges. Okay. So if you've gone to that diagram section, you guys can see this picture here to help you guys practice with identifying. This is a great way to do that. So I definitely recommend you guys, practice with being able to identify where the different bones are located. So we've walked through all of these, so I'm going to walk you guys, through this a little bit quicker. And you guys, again, know that you can pause and go back whenever you guys need to in these videos. But number one is pointing to that clavicle. Number two is pointing, you can see it's a little bit more posteriorly located, that's the scapula. Number three is pointing to our sternum. We talked about when we were talking about our thoracic cage. It does already point out the top of it called the manubrium, so you don't have to label that, and the xiphoid process at the bottom, but definitely be familiar with those. Number four is simply pointing out the ribs. I know we talked about the true, false, and floating, so definitely be familiar with those as well, but as far as identifying, these are just the ribs. Number five, so we're looking at our arm here, so number five is the humerus. Number six, over on the right-hand side of this person, 6 and 7 are pointing to the ulna is number 6, and the radius is number 7. Again, remember ulna on the pinky side, radius on the thumb side. Number 8 is the carpals. Number 9 are the metacarpals, and number 10 are the phalanges. Now, number 11 is simply pointing out the entire pelvic girdle that we talked about, so that entire pelvic area, but it does point out the 3 parts of that coxal bone that we talked about. So the ilium, there in green, the pubis you can see in the front, and also in this lower right-hand side of the picture, you can see the pubis in the front, which is colored as pink in the diagram there. And then the ischium down there at the bottom, labeled as purple. And then our lower limb, number 12 is pointing to the femur. Number 13 is pointing to the patella. Number 14, there in the center, is the tibia, and there on the lateral side is the fibula, number 15. Remember tibia and fibula. Number 16 are the tarsals. Number 17 are the metatarsals. And number 18 are the phalanges. So there's our diagram of the skeleton. All right, and the last thing we're going to end this video with are the types of joints. So I mentioned that there are a couple different types of joints, and a joint also synonymous for articulation, meaning that where two or more bones are going to come together. And there's three different kinds in the body. We have immovable joints that we talked about earlier. Those were called sutures. These were actually found in the skull. That's the only place you're going to find a suture. We know that two different bones come together in the skull. There's no need for movement there. There's no need for the separation or the movement between the frontal and the parietal bone, or the occipital and the temporal bone. There's not going to be any movement between those. So that's an immovable joint. We have joints that are slightly movable. Those are sometimes called cartilaginous joints. The best example of these would be at the vertebrae. And I'm not talking about, I know that my entire back can move, but looking at looking at two different bones there in the vertebrae, so maybe just looking at T6 and T7, the movement between just those two bones is not very great. There's only a slight sliding that takes place between those two. It's the collective movement of all the vertebrae that's going to allow my entire back to bend over, but just looking at between those two, that slightly movable joint is only, barely moving. And again, I mentioned that it's sometimes called a cartilaginous joint, and that is because it is filled with so much cartilage in between those two bones. And then lastly, we have our freely moving joints, which are the most numerous of all the joints we have in our body, and these are referred to as synovial joints. And we talk about that here on the next slide. So here, just to show you guys our freely moving joints, because they are freely moving, we are going to see a different structure here. So of all of our joints here, we have, like for instance, we're looking at our knee joint. This is an example of our synovial joint. Our arm, our elbow is a great example, our wrist, our neck. I mean, there's synovial joints all over the place. But all these joints, there's a need for more protection. So we're going to see the presence of articular cartilage, what we talked about earlier. So you can see on the end here of the femur and at the end of the tibia, we see that articular cartilage. This joint itself is surrounded by a capsule. That capsule is going to help contain a fluid that's in there. The synovial membrane that's lining the inside of that capsule helps to produce a fluid called synovial fluid. And that synovial fluid is going to help to provide a lubrication for the movement there at the knee. There's also the presence of sometimes some more cartilage. Some joints have what's called bursae, which are tiny little sacs of synovial fluid located near the joint. And then we'll also see ligaments and tendons nearby. But the main reason I showed you guys this is because I wanted you guys to know that a synovial joint is a little bit more involved, and that again, because of the need for more protection, I do want you guys to see that there's a joint capsule, and also know that there's a membrane that lines the inside of it filled with that fluid that helps to provide more of a protection. There are different types of synovial joints, and you guys may be familiar with those. I won't test you guys on this, so you don't need to worry about it, but I do point them out because there is a difference in the way that sometimes these move. Like for instance, we have a hinge synovial joint, like the hinge of a door. A hinge joint can only move back and forth this way. So like our elbow and our knee. I can't move my elbow side to side. This is actually the movement of my shoulder that's allowing that movement to take place. A hinge joint can only move this forward and backwards motion. A ball and socket joint, like at my shoulder and at my hip, it's just that. It's like a ball and then there's a socket, and that allows for a lot more range of motion there. And so my shoulder has the ability to move all the way around, to move forward and backward and up and down, and that's a ball and socket joint. So there's all kinds of different types of joints. So if you ever see these, just know they're all great examples of synovial joints. And again, I won't test you guys on the specific types. I do just want you guys to know synovial joints. These are just a couple big synovial joints that we have in our body. So clinically, they're important to be familiar with. So I do want you guys to know these four. We have the tibiofemoral, which is the one at the knee. So hopefully, guys, you can see the two names of those bones there, the tibia and the femur. This is a very big joint. It's very important to be familiar with clinically because of how we oftentimes see issues at this joint. Same thing with the glenohumeral. This is the glenoid cavity, which is just at the shoulder. So know that as the shoulder. So it's where it meets the humerus. So the movement of my humerus bone up there. Again, sometimes we see a lot of baseball pitchers that have a lot of issues with this joint because of that constant movement there. Sometimes we see people who throw a lot have issues at their elbow. So the humeroulnar is where the humerus meets the ulna. So the name implies that. And then we have the coxal, which is the hip. So where the femur and the acetabellum is simply just where the opening of the hip, where the head of the femur meets that. So that coxal joint is that hip joint. And we see a lot of issues with the hip, especially as people sometimes get older because we walk so much. A lot of times hip replacements have to be done. So these are really important in clinical settings. So I would definitely be familiar with these four and what they are called. And there are different types of movement that I want you guys to be familiar with. And we'll see some pictures on the next slide to show you guys some examples, and I'll try to do some as I'm over here in the corner. But flexion versus extension. I do want you guys to know that flexion, whenever we tell somebody to flex, what's the first thing they do? That, right? What they just did is they brought that lower limb up to the upper limb, and that is the bending of a joint. So we refer to that as flexion. Whereas the extending, the opposite of that would be extension. So the picture on the next slide shows that with the knee, that where the tibia and the fibula down here bend, so bends kind of closer to the femur, I guess you could say, that is flexion, and extension is when we straighten that back out. They show that down here with the hand as well. So here we have flexion, so the wrist pointing downward, and then the wrist straightening back out is extension. If you ever hear the term hyperextension, that just simply means hyper. Oftentimes when you see that prefix means too much. So hyper means that we've gone past that point of extension. So it's like it's too much extension is a way to think about that. So the next two terms on there are referring to dorsiflexion and plantar flexion. It's specifically referencing the feet. Dorsiflexion, so this picture right in the middle there, dorsiflexion is the pointing of the toes upward, and plantar flexion is the pointing of the toes downward. I oftentimes think like planting toes down. I don't know why. It's not necessarily the same case. It's more like ballerina toes, but plantar flexion is down. Let's see, the next two terms on there, so that was pointing out plantar flexion and dorsiflexion and hyperextension. The next two terms on there, abduction versus adduction. So they're showing this on the left-hand side of your screen here with the leg. Abduction means movement away from the midline of the body, whereas adduction is coming back towards. So the difference between the two, and you can do that with your arm too, when you take your arm away from the body, that's called abduction. So ab with a B, B for boy. And then adduction with a D for David, moving it back towards the body. The way that I always remember that, and this may sound pretty silly, but it's how I've always associated it. But when you're abducted by aliens, so the one with the B in it, abduction means you're taken away, right? When you're abducted by aliens, you're taken away. So to go away from the midline is to abduct. Okay, I know that's silly, but it helps again. Then we have inversion versus eversion. Looking at this top center picture, it's referring to the soles of our feet. When the soles of our feet are going in, so think the prefix in. So when they're moving in towards the body is inversion, and eversion is in when they're moving away from the body. Let's see, and then supination and pronation. I showed you guys this earlier when I was showing you guys the movement of the radius and the ulna. Supination is palm facing up. So on my picture here, palm facing upward is supination. Sometimes we use the term supine for a lying down position. If somebody is ever in a supine position, it means that they're lying with their belly facing up. So it could refer to either one. Supination, meaning palm facing up or belly facing up in a lying down position. Or pronation, when we turn the palm downward, that's pronation. Or again, when we're referencing lying down, then we're lying on our belly. Whereas in the last term that they're referring to there is circumduction. So down here they're showing this. So we have, it's not mentioned on that slide, but when we rotate, if something rotates like my neck rotates in a no position, that rotation is just, you know, that's what rotation is movement kind of on a center axis. But when a body part can make a full circle, that's called circumduction. So they use the example of the shoulder, how I can move my arm in a full circular motion. That's called circumduction. So remember that circle, meaning, you know, the prefix of circumduction sounds the same. If I move my entire head in a circle, I think you guys would have to call an exorcist. But that's, again, that's just rotation. All right, and those are different types of joint movements. All right, guys, so that does it for chapter 8. So I went through that chapter fairly quickly. Don't forget, you guys can pause, rewind, go back, and feel free to ask me any questions anytime you guys have any at all. I'm here if you guys need anything. But you guys can go ahead and move on to chapter 9 in the second part here of week 2.